to move on and share with you a new strategic initiative that we're very excited about, and that represents a tangible example of how this really supports our new direction forward. So this initiative is called the Palliative Care ECHO Project, which we have the privilege of leading alongside several key partners to help build primary palliative care capacity. Project ECHO stands for Extension for Community Healthcare Outcomes. And it was developed in 2003 in the US at the University of New Mexico. And it's a hub and spoke model designed to connect primary care providers to specialists to provide just-in-time consultation support and learning for the care of patients and conditions for which there were no local specialists to refer to. The Palliative Care ECHO Project is a capacity building telementoring program designed to create virtual communities of learners by bringing together local healthcare providers and community leaders with regional, provincial, territorial, and national subject matter experts for training, for deep dive learning, for brief lecture presentations and quality improvement discussions, really fostering this notion of all learn, all teach. That's the approach that the ECHO model takes. Next slide, please. So the Palliative Care ECHO Project is a 5-year initiative funded by Health Canada that will harness this ECHO approach and technology to really help accelerate the spread of the palliative care approach right across the country, and more importantly, build palliative care capacity. So leveraging this hub and spoke education model, and John's going to describe this in just a moment in more detail, and through the leadership of the hub partners that we bring on board, this project will help healthcare providers build local capacity by equipping them with the knowledge, the skills, and the confidence, along with updated tools and resources to ultimately help them provide earlier, more effective, and more compassionate, high-quality palliative care to patients and their families and their caregivers. The content that is shared through this hub and spoke model will integrate with existing local palliative care education programs or capacity building activities and resources. It'll ultimately serve to strengthen and complement these activities that are already underway. It's not meant to replace them, but to complement them. The training and development priorities that are established are done so collaboratively with each of our hub partners. So Pallium's role is to source or create content to meet hub needs, and are delivered through what is called an ECHO session, which is simply Zoom video conferencing, to be quite frank. The great news is that all ECHO sessions are free of charge, and each ECHO session is evaluated to ultimately improve future sessions, and it'll also help to identify any new training or development opportunities. So with this concept in mind, I'm going to pass the floor back to John, who will speak in more detail about our hub and spoke model.
That's great. Thanks, Jeff. And this really is the sort of secret sauce, if you will, behind the ECHO model, certainly one of the key factors of success for it. And so the diagram you see here is a simplified graphical representation of the interaction between Pallium as a super hub and the different hub partners, which we're in the early stages of actively recruiting and engaging with now. And the way it works is, as Jeff described a little bit, the hubs identify specific partners based on the communities or the audience, if you will, that they are servicing, and the priorities or learning priorities that exist within those hubs, and their representative spokes that link in with them. And Pallium works with those hub partners and with the other hub partners to identify and share resources that can deliver on those learning priorities or learning needs. And this is this concept of force multiplication of learning, where the hub 2 is learning something valuable and then sharing that with the other hubs, and the other hubs are building on that and sharing that back. And Pallium is the grease at the middle, if you will, that's helping to make all of this work and doing that curation and project management work to help support all of these pieces, as well as the data and the evaluation work to make sure that what we're doing is effective, that we're delivering on what we said we would deliver on, and that we're meeting the needs that have been identified. So next slide, please. It's important to realize too that this is not a one-size-fits-all model. We expect every hub to be different in the way that it works. But a simplified version here, you see with the hub, and at the center of that, we the hub coordinator role, which we'll talk a little bit more about, but a key function. It's not just the hub coordinator. There will be a team of people we expect in most of these hubs working with the hub coordinator, but basically that hub team then collaborating with local spokes. And these spokes may be a local family health clinic, they may be a hospice, they may be a long-term care facility, but these are the places that employ the people that provide care to patients and their families. And so all of those spoke groups are coming together and receiving the education that is then delivered and coordinated by the hub itself, and Pallium supporting that. And we envision a world where these hubs have some existing programming. Many of these organizations that are engaged in becoming a hub are already doing something in terms of education around palliative care, et cetera. And the opportunity there is for them to then take, hey, I've got this new program that's available to me through ECHO. How do I bring that in because it meets a specific need or something I was struggling to meet before? I don't have to create it again. It's proven to work, and I've got some support to help make it happen, as well as being able to then access national ECHO programming. And so Pallium as a super hub will also be delivering certain types of education on a national basis. And so there's some examples there around a journal club, around a QI series, or around, you know, the national webinars that we've been running, we see continuing as part of Project ECHO around national best practices and sharing information. So all those resources together are then available to be delivered by the hub to the spoke partners, and also be able to be shared then across other hubs to be delivered to other spokes, and so on and so forth. And that's where that multiplication comes together. Next slide, please. And this is where the model has been proven to work. Almost 400 hubs and super hubs functioning across the world as part of Project ECHO on all types of topics, not just palliative care, but all types of healthcare topics and issues. We're dealing with hubs in 40 countries and participants in over 144 countries. So really strong uptake in response to the ECHO hub and super hub model. And we're very, very excited to be becoming a super hub here in Canada soon on palliative care.
Indeed. Over to Jose.
After all these months, and I still forget. So we've heard some examples from John about what a hub can start looking like, or what the system can start looking like. So what I'd like to focus on this slide is what activity will be happening within the hubs. And so as Jeff and John were saying, it can vary, and it really depends on the hub's activity. So the hubs can be different things for different groups, different people, and can look in, as I said, look at things in different ways. So for example, it could be informed by a geography. So it could be a hub reaching out to rural physicians, rural nurses, rural healthcare professionals, and even remote. Pallium has got a long history of reaching out to rural and remote healthcare professionals. It could be in a specific setting of care. So for example, healthcare professionals and other care providers working in long-term care. It could also reach out by profession or specialty area. So personal support workers, for example, or hubs of, say, cardiology or nephrology, spreading the know-how of how to integrate palliative care in their various specialty areas. And then obviously very important, the populations served. And the example here are the Indigenous populations. There can be hubs to support palliative care in those areas as well. The second important thing is that these hubs are usually led by an organization. So there's leadership, and the examples we provided here are very good examples of vibrant hubs that already exist in Canada. CAMH, for example, out of Toronto, that focus on mental health, addiction medicine, is a hub that's been very successful and been led by the CAMH crew. There is the Chronic Pain and Opioid Management Hub, led out of the University Health Network in Toronto, and then a pediatric palliative care hub and pediatric pain hub, led by Sick Kids. So a lot of opportunities for a lot of organizations to participate and to partner with us as hubs. Next, please. So here are some examples of what an ECHO session can look like. In the first one, it could be interprofessional team of palliative care experts that come together with monthly sessions. And the ECHO is the platform by which we offer those sessions using Zoom video conferencing technology. What they usually look like is a short didactic overview, much like we do our theory bursts. We've called them, we've been doing that for many years, since 2000. And then followed by a case-based, patient-based or problem-based discussion, where you actually use a real-world case to address learning points and to learn together, to share. It is a very knowledge constructing exercise and activity. And then that follows with more in-depth discussions, so that from that we hope that we can disseminate a lot of, as we've been doing with the webinar, with the webinars during the COVID webinars, is capturing a lot of tacit knowledge and experience that's emerging, that's new, that we can then capture, codify, and help spread. The second example is monthly lunch and learn webinars, for example, with personal support workers who can come together and share experiences, share insights from their various organizations and even across the country. So a fantastic way to spread new ideas and innovation and learnings. And also, it's also about sharing where things have failed or not worked, because we always think of them as failures. Rather, they've been learning opportunities, and we can share those learning opportunities. And that's an example of how we're adapting more and more a quality improvement mindset, so that we can be quality improvement facilitators in the healthcare system. And on that point, another example of the sessions we'll be doing would be quality improvement sessions. And we've just recently collaborated with the McMaster Palliative Care, the Joshua Shared McMaster Hub, where we hosted a whole Innovations Day together with McMaster. We hosted a whole afternoon actually on innovations and learned some fantastic innovations across the country. So imagine that would be a regular thing where we can showcase examples of lessons learned through quality improvement exercises across the country. Thank you.
You, John.
Great. Thanks, Jeff. And so we want to talk a little bit about the role of the hub coordinator. And I'll stress at the start that this is really an example of what the role will look like. It really is up to the individual hub in terms of what their needs are and the function and the role and how that will support the work of the hub. But we envision this primarily as a part-time, in a lot of organizations that we've been discussing this with, there will be other responsibilities that will fall on this person's plate in terms of whether it's education focused or coordination within a network, etc. But really the key function from a Project ECHO perspective is promoting and supporting the implementation of the Palliative Care ECHO project within their hub and among the local spoke partners. They'll also be responsible for creating a lot of that connectivity back with the super hub and between other hubs. And that's something that Pallium will be supporting directly through our project manager. This could be a new position within the hub. It could be an existing role. It could be something that's added on to that role, etc. That really, again, is up to the individual hub. And happy to say that through our support for this project, we're able to provide a little bit of funding to help offset some of the costs for the individual that will be taking on this work as part of the coordinator responsibilities.
Okay. Okay, thanks, John. So as you've probably gathered up to this point, Pallium's role in all of this is akin to an orchestra leader. In addition to being the lead for this initiative, we work very closely with our hub partners. We conduct needs analysis with each of them. We hold regular status meetings to ensure they're on track with project deliverables. We play a coaching role. We also connect them with other hub partners, as John mentioned earlier, to support the knowledge exchange. But we'll also be curating content, and in some cases, we'll create new content. We'll lead all the national ECHO sessions. We also support the overall project from an IT perspective, and we also lead the evaluation on the impact of ECHO, which actually Jose would be speaking to us about right now.
Okay, thank you. So I mentioned in the first part of the session today the evaluation framework plan and research plan that we're developing, and there's a connection with this as well, because we want to make sure that we have the right framework to really understand the program, both from, as I said, from an attribution perspective, what is the impact, but also in a contribution, what helps to scale up, and etc. So on a micro level, every ECHO session will be evaluated so that we can support the ongoing evaluation of the sessions and the whole program. And then there's also, on a more macro level, working with partners, so the different hubs, evaluating the impact and also the spread and scale actually of those various hubs. And so all hub partners will be given access to performance data. Our IT ecosystem now and infrastructure allows us to put together reports very, very rapidly. And that includes dashboards to tell us how we're doing, how's it spreading. For example, with the COVID webinars, we've been able to track how many people registered, how many have participated with our online courses. We know how many people signed on, how many of the modules they did. All that helps us drive further development and more scale and spread strategies. So obviously, overall, we want to see how the Palliative Care ECHO program is doing from these different perspectives, and hoping to collaborate with colleagues from across the country to do that evaluations.
Great. Thanks, Jose. Okay, so when we look at the overall desired outcomes from this national initiative, we believe that together we can achieve the following. First off, we believe that a larger base of healthcare providers, and we're talking across different settings of care and geographies, and as we say here, professions, who ultimately will integrate the palliative care approach into their practice and provide more timely care. Secondly, we also believe there's going to be a larger network of healthcare providers who engage in knowledge development and sharing, right? And spreading tools and resources related to providing a palliative care approach to their patients. That knowledge exchange is critically important. So we really do hope to see not just a larger base of healthcare providers, practicing better, more timely care, but are engaging in that knowledge exchange, right? It's that whole notion behind, what ECHO is all about. Providing more opportunities for healthcare professionals to access specialist level palliative care, whether that's through virtual learning or just-in-time clinic supports, as we say here, or wherever is needed. This is ultimately a really big plus for ECHO. So as you can appreciate, this is really actually not about LEAP programming. These are interventions that complement and go beyond what we do with LEAP. So being able to support, as we said very early on, that lifelong learning journey, ECHO is the vehicle through which we can support that strategy. Another one, number 4, is more specialist level palliative care teams equipped with the technology and the skills to allow them to impart their knowledge and provide more teaching opportunities to healthcare professionals in their region and beyond. And ultimately, as well, to provide opportunities for more palliative care providers across the country with QI skills and to support undertaking QI in the workplace. It's something that we know is gaining greater prominence over the recent past. So we're happy to be supporting that strategy as well. So in terms of a wrap up, if we move to the next slide, please. So that pretty much wraps our presentation up. And as I mentioned to you earlier, you can visit Pallium's website at pallium.ca. If you click on the About tab and under the Strategic Plan header, you can download a copy of our 3-year plan. If you're interested in being on our Palliative Care ECHO project mailing list, please visit one of these two URLs, echopalliative.com. And want to thank you again for taking time out of your schedule for joining us today. We really hope that this has been informative. And I want to take a pause. Robin, we'll open up the mic to you to see if there's any questions or comments that we want to highlight.
Great, thank you. Yeah, we did get one question just in terms of what's Pallium's vision in terms of incorporation of these kinds of hubs for the ECHO project in the midst of Ontario Health, creating those Ontario Health teams.
Yeah, well, we see the creation of hubs to be very complementary to these burgeoning OHTs, if you will. In fact, we've talked to many of them about themselves either becoming hubs or banding together as many OHTs to be part of a bigger hub, if you will. So I actually think it's meant to dovetail and complement the activity that's already underway within these OHTs. As we mentioned earlier, many of our hub partners or to-be hub partners are already engaging in training and development, and we're not looking to duplicate any of that effort. But in working with these partners, it's what more can be done. There's always room for opportunities. There's always room for additional training and learning. And that's what we'd like to bring to the table at no cost to them. And so if we look at these OHTs, we think it actually could be a very for us and an opportunity to strike more hub partnerships and add greater value to the healthcare professionals that they serve within their region. Thank you for that question, Cindy. Any other ones that we've answered already that we want to highlight, Robin?
Yeah, Jeff, there were a couple of questions about programs and resources to support communities and patients and caregivers and volunteers as well. And so in the chat, I highlighted in response a couple of key ones that we're working on that we're actually coming to very close to launch on. So one is a Care Maps program. And this is an exciting program. It builds off work from the Atlas of Caring out of the US, where really what you're doing is drawing a hand-drawn sketch of the support network around you as a caregiver when you're providing care or support for someone in need, someone at the end of life. And this is a program to help you to either A, develop and build that yourself as an individual, or B, we've actually designed a workshop program that compassionate communities across the country will be able to deliver either in person or online to support people in their community in developing their care maps. And then the third piece of that puzzle that we're building is a short learning module for healthcare professionals to understand more about these community care maps, how they work and how they can either use them or understand and support their patients and families that they're working with who may have developed their care map. So we're excited about that, and it dovetails well with other work that we're doing around a faith community toolkit to better understand the palliative care and end of life process in this case Catholic parishes, and a bunch of other new exciting stuff, including Elite Cares that we're working with Champlain Lynn on adapting one of their courses for caregiver-focused education. So lots happening in that space.
And I think too, when we take all of that, John, and we marry that up with the opportunities that ECHO presents at a community level as well, I think this is, I think Diana and others who have asked information about this, you'll see more coming forward as part of the work we're doing with ECHO. So very exciting for supporting communities. Good. Okay, so I don't see any more open questions. I want to thank all of you for taking time out of your schedule. As I mentioned, a copy of the plan will be on our website. And I want to thank my colleagues, John and Jose, for presenting alongside me and bringing our plan and our new initiative to life. I hope you enjoyed this and appreciate your participation, and we look forward to keeping in touch with all of you. All the best.
Bye, everyone.
Bye.
Bye.